Hey everyone, it's Dr. David here. We're going to be talking about lumbar stenosis, the 10 best treatments to help you heal from lumbar stenosis. I'm just setting everything up here. Let me get going on Instagram. And you guys, let me know if you can see me and hear me. Let me turn on my banners here. Here we are. Comment if you can hear me. And if you can, also let me know where you're from. We've got a few new members to the channel. We have Andrea Tellman. Thanks for subscribing on YouTube and becoming a member. Who else is here? Evelyn Taylor is a new member. Thank you, Evelyn. And MBR. Thank you, MBR. Oh, cool. We have Chuck. I'll just say Chuck. Chuck says yes. And Chuck's in Texas. Fellow Texan. Awesome. Fantastic. Anyone else here? Kimberly's here. She says, hi, Dr. David. Hear you great. Lori Wilson's here from Ohio. Great. Thank you guys for letting me know you can hear me. And let's get going. Can we do that? Let's get the show on the road. We have Darlene from Michigan as well. More comments come in. We'll get to them. Hey, Darlene. All right. So what are the 10 best treatments to help lumbar stenosis? Before I get into it, because I do want to just clarify what kinds of stenosis there are, and because a lot of times you might hear from the doctor that you have stenosis if you have a back problem, but you don't know what kind, and immediately if you're not medically trained, your brain might go to, oh no, I have stenosis, it's serious, I need surgery. Yes, there are some stenosis problems that need surgery. Many don't though, and you can live with them just fine if you fix some things, which I'll guide you to do. But let me just show you what I mean here. Actually, I'll use the model. That'll be better. So here we've got a spine model. This is just two bones. So you imagine more bones above this, maybe one or two below this, and your tailbone would be down here. The yellow thing right there is the spinal cord in the middle, and then you have the nerves that come out to the sides right here, and the red thing in the middle between the bones simulates the discs. When we talk about stenosis, stenosis just means a hole somewhere in the body is narrowing. Like you hear about stenosis in the heart, in the blood vessels. That means the blood vessels, it's a hole where blood passes. It's narrowing, and that's obviously a bad thing that can set up a heart attack. When we're talking about the spine, lumbar spine, the low back and stenosis there, you can have central stenosis or lateral stenosis. Sometimes the lateral stenosis is also called foraminal stenosis. So central stenosis means the central part of the spinal cord right here, the hole there where the spinal cord passes, is closing in somehow, some way. It could be for a variety of reasons. It could be the disc is herniated directly backwards in the middle against the spinal cord. There's also ligaments and other stuff within the spinal canal right there where the spinal cord passes, and you can get thickening or hardening and folding of some of those ligaments in there. The ligamentum flavum is what it's called for those of you guys that look up this stuff. And as depending on muscle imbalances, which I'll talk about here in a minute, and partially age in that you've, let me clarify with age, because I don't want y'all to think, oh, I'm old, I have stenosis, there's no help. It's pressure over time. That's what causes these problems. It just so happens that you've given your body 20, 40 years of pressure over time. And so now you're older, you're 50s, 60s, 70s and beyond. And so we associate it with age, but it's not necessarily age, it's pressure over time, because you can get better. Oftentimes you can get better. There is stenosis that is so bad you need to have surgery, but there's a lot of stenosis that can be managed non-surgically if you're doing the right treatments. Okay, so that was central stenosis. Sorry for the detour. Let me tell you about lateral stenosis or foraminal stenosis. That's when the opening on the side right here gets narrowed. And you can see that it's made up, the top half of the opening is from this bone up here, and then the bottom half of the opening is from this bone right here. So it's influenced by what's going on in the disc and the bone above and the bone below. All those components come together to make the hole for the nerve on the side to come out. So if you get a disc herniation that pops into the side right here, then you can have foraminal stenosis. You can also have arthritis of the joint. The joint is right there where I'm putting my finger between the two bones right there. If that gets thick, if you get some big bone spurs, it can definitely push on the nerve there. There's other factors involved as well. Those are the most common ones. All right, so lateral stenosis, central stenosis, the difference in symptoms are slightly different too. Stenosis from central stenosis, you'll get pain going down both legs potentially. You might also get pain. Oops, let me make my tickers work right. Would you make that one work, please? I don't know what happened there. I might have clicked on the edit button. Maybe hit save. So central stenosis is pain down both legs. And then in the extreme, like when it's really bad for central stenosis, you can get what's called neurogenic claudication. Big words for your legs start to get weak and heavy, maybe even numb and tingly. And then you have to sit down. And those people with those symptoms usually can't walk they're limited on how much they can walk because of the heaviness and the pain and tingling in their legs. If you're at that point where you have neurogenic claudication, and it's short, like you can't stand for more than 10, 20 minutes, maybe 30 at most, and you feel like you have to sit down, that's the more severe kind that you might actually benefit from a surgery. There's surgeries where they will remove the bone in the back. It's actually a pretty good surgery. There's no going back though. There's still muscle imbalances to deal with. It doesn't fix a muscle imbalance. There's still issues that surgery won't fix. However, when they remove the back part of the spine here, the bone, it opens up the space and allows for an improvement of that neurogenic claudication, the heavy legs when you stand up and walk. There's more to that. I'll explain why that happens before we're done today. And then with the central stenosis, I'm sorry, I just explained central stenosis. With lateral stenosis, you usually get pain on one leg, on one side. You might get weakness on one side as well. It tends to be just one side, and very similar symptoms to sciatica. In fact, it might be mistaken as sciatica, a disc herniation, sciatica symptoms, and then lateral or foraminal stenosis. They're all kind of related to each other in symptoms. And in like if you look at your imaging, like you might have all three problems. It's hard to tell them apart. All right, so that's the premise of all this stuff. Just want to make sure we're all on the same page. So you might be here and you might have sciatica, you might have arthritis, you might have lateral stenosis. Hopefully you don't have central stenosis with neurogenic claudication. That's the extreme. But all of this stuff that I'm going to explain here is going to improve your stenosis, except for that extreme one that you might need surgery for, but those are far and few between. All right. Before I get into it, let's see where people are from here. We have Karen Green from Levittown, Pennsylvania. Hey, Karen. Valerie says, just what I'm struggling with. Oh, I love your hair, Valerie. Beautiful curls. I love curly hair. Mindy says, so nice to see you, Doc. It's nice to see you too, Mindy. We have Normal to You says, hi from Aberdeen, Maryland. Fantastic. We got people all over the country coming in. Darlene says, I've been doing your knee exercises for bone-on-bone knee pain. Hopefully they're working, Darlene. Let us know. Peggy says, finally following your suggestions and I'm able to walk again. Hip imbalance is improving. Yes. Awesome to hear, Peggy. Thank you for letting us know. Katerina Sukova says, hello, Dr. David from England. Awesome. Europe's in the house now. We got England here. Bebe G63 says hello from Georgia. And then we have Darlene saying, I have spinal stenosis. I was diagnosed 8 years ago. Thank God it hasn't been a real problem. Good for you. That's great. Yeah, you can have a diagnosis of stenosis on an MRI. I just rhymed. But it's not painful. That happens all the time. You can have, just like in your knees, you can have severe arthritis, but it doesn't hurt. Same thing in your hips if you have hip arthritis or a meniscus tear or a rotator cuff tear. It's interesting. We're finding all this stuff on MRIs, and sometimes it hurts, sometimes it doesn't, which is a good indicator that you might not need surgery because that's not the source of your pain if you have a tear or severe arthritis and no pain. All right. And then we have Keto in San Diego. Keto in San Diego. Awesome. Hear you in San Francisco. Very cool. Darlene says, thank you for your help. All right, let's get into the first thing on my list here. We've got, I'm assuming you're severely in pain. Okay, so if you have stenosis, if you've been diagnosed with lumbar stenosis, and you're in severe pain, like your back hurts, your legs hurt, you're having trouble walking, this is where you would start with the top 10 best treatments. So I just put on lotion. We're going to do a knees to chest, and I'll demonstrate everything for you here as well. So here's what it's going to look like. You're going to lie on your back somewhere, on your bed at home, wherever you feel comfortable. And you're just going to bring your knees towards your chest. You can cross your feet if you want. You don't have to. The idea is just to flex your spine or bend your spine forward rather than extend it. And also, when you bend your knees, you're taking neural tension off your whole nervous system. You're putting slack rather than tension on it. Because when you stretch out like this, especially if you extend backwards, you tend to add a lot of tension to your nerves, and that could send symptoms down your legs. But when you bend your hips and knees like this, it tends to take pressure, tension off your nerves. And this just feels good for a lot of people. When you're in pain, it's hard to know what to do. This is a good starting point just to get relief. Now, this isn't going to fix the problem. We're not there yet. Right now, we're just trying to get relief so that you're not taking medications, relying on injections, desperate to visit the doctor and just cut me open and fix something. Hopefully we're not there, but if you're getting there, this might be something you do. And all I want you to do is hold your knees towards your chest as best as you can, comfortably. You don't have to be uncomfortable doing this. And hold it for 30 seconds, a minute if you can. Usually 30 to 60 seconds is enough to then take a break for a moment, 5-10 seconds longer if you need to, and then repeat. And the idea is just to give yourself doses of slack through your nervous system and to take some pressure off your spine too, because this can take pressure off the discs, the vertebrae in your spine. Real easy, gentle thing, kind of a stretch more than anything else. Like a stretch, a decompression through your spine with slack on your nerves. That's the intent here with this one. It's a good starting point. And then an alternative, because some people have trouble doing this on their back. They can't bring up their legs. You might have hip pain that prevents you from bringing up your legs. You can do this in side lying as well. So if, depending on your back pain, hip pain, all that, you can bring your knees up towards your chest and get pretty comfortable here and relax from here. Now, coming up all the way is what you want to do more or less, but if for some reason it's not helping you, it's not hurting you, it's okay to come up a partial amount. Generally though, when you're more straight like this, it tends to not take pressure off your back and add slack to your nervous system. It tends to add tension. So you don't want to be straight. And then what you want to avoid as well on doing the knees to chest, because I see people doing this, is they'll say, okay, well, I'm bringing my knees to my chest, and then I'm going to hold behind my thighs and maybe start to stretch out a leg or both legs, or they'll go towards like a what do they call it, happy baby, where they try to touch their feet and they bring their legs up like that. That is a bad idea. Don't do this. The reason is because you're adding tension to your nervous system. You'll immediately feel a stretch in your hamstrings, maybe your calves. You might even feel symptoms going up your spine into your head in some cases because of all the tension you're putting through your nervous system. And remember the concept that I explained with the nerves is something's pressing your nerves. And when you try to pull it out, it's as if I had my shirt pinned down right here, like if it was stuck to my skin somehow, and I try to pull it, it's not going to slide very well. We want our nerves to move within our body without any resistance. And so if it hurts right now, you don't want to do anything that's going to add more tension to your nerves. And with stenosis, with lumbar stenosis, your nerves are not happy. And if it's not hurting a lot right now, if you're like this person that commented earlier who got diagnosed, but it's not painful, then this is not where you want to start. I'm just giving you this extreme pain scenario. This is where you would start. All right, let's go on to explaining the second one here. I learned this one early in my career, and it has been something that just hasn't gone away because it's so valuable. I call it hand to heel rocking. And it's a version of knees to chest. Let me show you what I mean. Except you're loading your body with a little bit of weight. So it's kind of a progression. You have to be okay kneeling like so and being on your hands like so. And if you have trouble with your knees because you have, say, arthritis, if your knees hurt for whatever reason, just put pillows under. And you're going to be bending your knees more, so just be mindful of that. Just bend whatever you can comfortably. And I like to be on my fist just because it's not as comfortable when I'm on my hands like this, but it doesn't matter. Then what you're going to do is just sit back like a dog or a cat sitting on its haunches. And when you go back, the intent is to curve your spine, like let yourself bend forward in your spine. And it's okay if you hang out here a little bit. You're decompressing your bones in your back. You're trying to take some tension off your muscles in your back as well, the back muscles. But because your hips and knees are folded like this, it takes tension off your nerves, just like the knees to chest movement that we did first. So it's a very low risk, feel good kind of motion. And then what I have people do is rock back and forth. That's why I call it a hands to heel rock. And I'll tell people do 30 reps, a minute's worth. It's okay if you do reps like I'm doing right now, or if you hang out at the bottom and you feel a little bit of a stretch in your back, not your legs, and just easily move. Super comfortable, very doable. Both this one and the knees to chest, the first treatment that I explained to you, I would do a lot at the beginning. I mean, I would do it every hour or so. A minute on each one would be fantastic. If you can do more than that, even better. The idea early when you're in high pain is to bring the pain down so that you can then tolerate other exercises that are going to be potentially aggravating to you if you do it right now while you're in high pain. So just keep that in mind. You don't want to start doing exercises that are straining on your muscles but painful to do right now. They might be good later, but not yet. I'll have to show you what I mean on the chart here in a second. Let's go to number 3 first. So I'm doing a different color just so that it can stand out a bit because it's not really an exercise. These are all treatments, but it's very helpful. Massage gun. Massage in general, I'll just underline it, but I like the massage gun in particular because it is so easy to use. And these days, the massage guns are very good quality for not that much expense. So this is a swan neck massage gun, and they built it like this so that you can reach your back really easy. But I like this one a lot because you can detach the handle right here and detach the head and bypass the swan neck so that you can also use it like a typical massage gun where you would use it, say, on your legs right here or somewhere else on your body. But then you can, because this isn't ideal to reach over to your back, you have to put your arm and shoulder in a funny position. If you get out the swan neck, and it's so easy to set up, as you can see. We'll have to put a link in the description for this in case you want to get it off of Amazon. That's where we got it. They make different ones. I tried different ones out, by the way, and this is my favorite one because it's got the best power. The other ones didn't have the greatest power. So once you get it going on, then I like to just hold it upside down like this and reach over to my back. Let me show you what's going on behind me. So I'm just going up and down the sides of my spine where the muscles are. Because the idea here is those muscles in stenosis, if you have lumbar stenosis, whether it's central or lateral stenosis, you tend to have a muscle imbalance where those back muscles that run up and down the sides of your spine. So if this is your spine, you're looking at the back, between this bone right here and these bones on the side, you have a column of muscles on each side. And you're trying to run the massage gun down the column of muscles on one side and then going to the other side and doing the same thing because those muscles get overused. They compensate a lot for weaknesses in other muscles. It's abdominals. When the abdominals aren't used very well, back muscles say, well, we don't get any help from abs, so we'll pick up their slack, we'll cover their job. But over time, over weeks, months, years, they start to get overdeveloped, and then they start to, because of their attachments, they start to compress a lot, and that's how you start to get disc herniations, arthritis, all the problems that you see. It closes the space for lateral stenosis. It starts to harden the ligaments and flavum, the stuff on the inside of the canal here, and that's what eventually ends up building to lumbar stenosis and what was the other ones? Arthritis and degenerative disc disease. So using the massage gun in the short term will allow those back muscles to soften up and relax, so that then you can begin to use the other muscles, the ones that you haven't been using, the ones that are going to fix the imbalance. You can use those muscles properly without your back muscles wanting to fire. When your back muscles are very compensated, they want to work all the time because they're thick, they're big, they will tend to fire first. And if you go try to do abdominal exercises, you're going to struggle a lot. You can do it. I'm not saying you can't do it, but it's just easier if you've softened up the muscles, if you've relaxed those back muscles, so that then you can call on your abdominal muscles, and your back muscles are going to say, okay, we're just taking the day off. You finally relaxed us. We're used to firing all the time. We're ready to jump in when you need us or when the abdominals don't show up. But if your intent is to now fire your abdominals because you're going to train them better, then let's calm down the back muscles. So that's number 3 is get one of these massage guns. You could also get a massage, professional massage if you want to go to your favorite spot. If you want to have a spouse or a family member that's good with massage help you out, you could do that too. If you want to get like tools yourself to get back there, you could do the grandpa trick, put something on the wall and just rub it up against her, like a tennis ball, a racquetball, a lacrosse ball. You could figure out all kinds of things to just soften up the muscle back there. There's no special, let me say this. There's a lot of techniques out there. You hear about like special massage techniques and physical therapy techniques. And I get it. There's a bit of science to all that stuff, but it's not proven 100%. I like that. I dig into it. But at the end of the day, what you want to do is just soften up the muscle. And whether you go to some special neuromuscular massage therapist, or you see a manual therapist like me, or you use a massage gun and just dig back there, don't stress out over the hair splitting details of, do I need this kind of massage or that kind of massage? Do I need this yoga ball or a lacrosse ball? It doesn't matter. All of it's probably going to work. Just soften up your back muscles in a way that doesn't hurt you, but allows you to relax. That's the goal. I hope that helps. All right, let's talk through the next one here. Before I get into that, though, let's check in on some comments here. Oh, no, looks like we're having trouble on Facebook. Sorry, Facebook. Jump on over to YouTube. We can see you guys on YouTube. Oh, we have a comment on here, a super chat. Sorry. Kimberly says, thank you for sharing your knowledge and compassion and helping us to have a better life. You're welcome, Kimberly. Absolutely. I'm happy to help. This is one of my favorite things to do. I love just helping people. I mean, I went to school for this stuff. I went through extra training. I put myself through a heck of a lot more training than most physical therapists ever need. But I love that we can help people on this platform this way, so that you can benefit from my knowledge. And you don't have to come in across the world and travel to see me. So hopefully you guys will apply this stuff and get better and be able to do the things that you love to do. That's my ultimate goal, is that you get to shine in the way that you're meant to, and your back isn't holding you up, or your hips or your knees or your shoulders, whatever body part I can help you out with. You're welcome, Kimberly. Thank you for your support. I appreciate it. All right. Who else is here? Darlene says, really? Wow, no happy baby. Yes. If you have nerve problems, you shouldn't be doing happy baby. I'm not saying happy baby is bad all the time. I'm just saying if you have nerve problems that go down your legs, like sciatica, stenosis with sciatica symptoms, or like the neurogenic claudication, you're just going to aggravate it, because nerves don't like two things. They don't like to be stretched if they're irritated, and then they also don't like a lot of vibration or pressure to them. So you don't want to be digging in there too much. That's why I gave you the guidance with the massage gun that I showed you a second ago. Use it on your back muscles, because you got big, thick muscle there that's usually overworked and stiff, and you're going to be pretty certain it's muscle. Yeah, there's little tiny nerves, but I'm worried about that big sciatic nerve that runs down the back of your leg. It's actually pretty easy to get to with the massage gun. I'd rather you not massage that area. But when you do the happy baby stretch, like I was showing, you're going to put a lot of tension through your sciatic nerve. And I'd rather you not do that, because it tends to set things off. And I mean, you guys have probably tried it and maybe run into some symptoms. I mean, if you have any experience with that, please let us know here on the chat. I'd love to hear it from somebody. Sue, AW1847, says, very interesting, Dr. David, from the UK. And then we have Peggy, says she's in SoCal. She has spondylolisthesis in the lumbar spine. Oh, those spondies. This stuff's going to apply, by the way. A lot of this stuff's going to apply to the spondylolisthesis. It's the same muscle imbalance that sets it up. And then we have Karen Green. She says, I have back and knee issues. Which should I focus on first? Or can I address them simultaneously? Great question. We have that happen all the time because it's the same muscle imbalance very often that affects hip, knee, and back problems. What I would go for is the one that's worse, Karen. So let me say it differently. If you have a knee problem, you probably need to focus on glutes more. If you have a hip problem, definitely focus on glutes more. If you have a knee problem, it could be that you need to focus on your feet too. If you have a back problem, you definitely need to get stronger abs. Abs, glutes, and foot muscles are the three key muscle groups that frequently get weak in people and set up these muscle imbalances that I talk about often. But if you have a knee problem, it's going to be feet and glutes. If you have a hip problem, pretty strong glutes, but it might be abs, might be feet too, usually glutes and abs. If you have a back problem, then it's going to be strongly abs for a lot of people, but glutes are a very close second. So take that into consideration. Feet can also still be very important. They are important for back problems too, but it tends to be the last 20% of the problem. You can have a lot of improvements if you focus on ab strength and glute strength for a back problem. I hope that helps. I should probably draw a visual for that. All right, let me get to number 4 here. We have ab activation. People with stenosis. I've yet to meet a client that's come in person to see me here in the office who has a stenosis diagnosis or any other back diagnosis that I've seen. So spondylolisthesis, of sciatica symptoms, back arthritis, degenerative disc disease, disc herniations. They consistently have very weak abdominals, and many, not all of them, but many have problems with even just activating the lower abdominals. That's what I want to emphasize here is lower abdominals. Let me just write it right here. Lower. Because a lot of them can activate upper abs. So if you can see my midsection here, here's my belly button. This is how you would look at this. Belly button is a halfway point between your upper and lower abs. Upper abs usually fire great for most people. Lower abs down here is where it doesn't fire great for a lot of people. And so what we want to do with this exercise, abdominal activation, is first just become aware of how to fire your lower abdominals. And the best way to do it is lying down. Let me show you. Come on over. Lie down somewhere on your bed, on the floor, wherever you're comfortable. Knees bent like this is a good starting point because it kind of sets your hips and your back in the optimal position to begin to fire your lower abs. And then what you want to think about with your lower back here on the opposite side of your abs is flattening your back down against the table. So I'll tell people, put your hand under your back here. That way you have feedback from the pressure on your hand. Then you're going to smash your back down into your hand or into the table or bed or wherever you're at. And when you do that motion, you should feel your lower abs engage. So the hand doesn't have to be there the whole time. That's just to get feedback, but you should eventually be able to do it without the hand and just smash your back down into the table. Posterior pelvic tilt is another name for this maneuver. People that struggle with this a lot, there's some of you guys that I'll have you guys do this, and then you do this instead. I'll say smash your back down into the table and get your lower abs to activate, and then a back arch happens. And that's the opposite of what should happen. You should be losing your arch in your back, flattening your spine against the table. To overcome that, what people usually need is just an idea of body awareness, body control. And so I'll say, go ahead and arch your back or stick out your butt all the way, then go the opposite way and play with that motion of tipping your hips back and forth. And where you eventually want to hang out to do this ab activation maneuver that I'm talking about is back flat. Hold it there. And then I want to go for 10 seconds with an emphasis on sucking in your lower abs right below the belly button. Going through this process, for a lot of people, they'll get it quick. They'll get it within a day, maybe even a couple of hours of practicing. But you really do have to concentrate and intend to do this. And I have a few people that don't fire their abs very well, that will take days, if not weeks, to get this. But you have to crack this. You have to figure this out. Otherwise, you can't begin to fix the imbalance. And any other exercises you do beyond this point are going to be compensated with back muscles and other muscles, hip flexors, and you're going to just add more pressure to your spine and worsen stenosis over time. You have to figure this part out. So back flat and get the abs to contract down here. Upper abs are going to contract too. That's fine, but what we want to do with this is bias the lower abs and get them to fire better than the upper abs. Said differently, you want, if you're thinking about your entire abs, upper and lower abs, you want your lower abs to fire 60% or more compared to your upper abs. So 100, 60, 40, or 70, 30, 80, 20. I haven't been, me personally, I haven't been able to improve beyond 80, 20. I don't think it's possible to get 100, 0, or even 90, 10 is tough, but you should feel like your lower abs are working at least slightly harder than your upper abs. That's the goal here. Practice that and master it. You have to figure this out in order to avoid having a surgery and fix the root problem that causes lumbar stenosis as well as a bunch of other back problems, right? So that's number 4, abdominal activation, lower abdominal activation to be very specific. Hope that helps you guys. Number 5 is glute muscle activation. Similar to lower abdominal activation, people with back problems, they often can't fire their glutes very well either. They can't, on command, tension glutes, like flex your glute muscles, tighten your glute muscles without leg muscles in your thighs also flexing. That's part 1. Part 2 is being able to tension just one side, your right glute, apart from your left glute. That's key because eventually we have to get to walking, which, by the way, with walking, because with stenosis, if you have neurogenic claudication, it's tough to walk. You might have trouble walking, but if you don't have it that bad, sometimes healthcare professionals out there will tell you, you have back pain, you have stenosis sciatica, you, as best as you can, go walk for exercise. And I think that's a bad idea because you haven't figured out how to fire your muscles right, your abs and your glutes. And in order to walk in an efficient way using the right muscles without compensating, you have to have gone through the process of figuring out these muscles. And to walk properly, it requires you to fire the left and the right glute independently of each other. And if you're sitting at home right now watching this and you're trying to figure out left and right glutes and you can't do it, you got a problem, a mission critical problem. Like, how are you walking right now? You're doing it. You're walking around, you live your life, you walk around your house, you go to the store, you go to appointments, you might work, but you're not using your glutes to do it. You're compensated with other muscles, and that's what's feeding into your stenosis problem here. So you're just going to get worse over time and fulfill the cliche of oh, it's an aging problem. No, it's a pressure over time problem. It's you're using the wrong muscles and it's putting bad pressure, and this just keeps going over time. So your stenosis gets worse, your discs get more herniated and degenerate more, and your nerves get more pinched and the sciatica gets worse. Eventually it turns into neurogenic claudication. We don't need that. So with walking, I'm going to put it in red here. It's something that you want to hold on. Hold walking. Let's make a little box for these right here. So asterisk, hold on walking until you figure this out. Let me write figure out. Oops. Looks like a G. I never got good grades for my handwriting. In case you can't tell. Ugh. Figure out walking. Or art. I can't even draw a nice arrow, but hopefully it communicates the idea here. So glute activation, really simple. The best place to start is just right here, from this view right here where we're at. Wherever you're at, if you're sitting, standing, or lying down, just close your eyes and think about tightening your butt muscles. Both together. Tighten them as hard as you can. Go 100%. Feel what your thigh muscles are doing. Are they also activating? If they are, then okay, relax everything. Then this next time you contract, only contract 50%. Go, 50%. Come on, are you doing it? Hold it for a few seconds. Think about your thighs now. Are they still contracting? Okay, relax everything. Then back off to 20%, maybe even 10%. What I want you to do is find the minimum percentage at which it's only glutes firing and your thigh muscles are relaxed. Then the exercise is you have to practice tightening your glutes, hold it. I want you to go 10 seconds and keep your thigh muscles quiet. Don't let your quads on the front of your thighs work. Don't let your hamstrings on the back of your thighs work. You want to only make the butt muscles tighten up. It's not going to be perfect ever. You might still get a little bit of thigh activity, but what you definitely don't want is a lot of thigh activity, more thigh muscles firing than anything else, because you're intending to fire your glutes, your butt. But if it's more thighs than anything else, it's not right. It's going to mess you up later on. It's like the abs. All right, so butt muscles. After you master that, it might take you a moment, it might take you a day or two, maybe a week or two. Then you have to practice, okay, just the right and just the left. Right and left. Hold it for 10 seconds on one side. Mind your thigh muscles. Think about them. Don't let them overpower your glutes. It should be glutes working. 10 seconds and then do the left and keep the right relaxed. The right glute has to relax when you're squeezing your left. And practice. An easy way to do this is if you're standing, is shift your weight over to the side that you want to work. When you lean on that side, tighten your glute and think about just the glute working and minimize the thigh. It helps too if you kind of slightly bend your knee. I don't know if you could see this here on the camera, but if you, in standing, so I'm tightening this side, my left side, and I'm going to just slightly bend my knee, see, versus locked out like that. Because when I lock out my knee, my thigh wants to activate right here. But if you just keep your knee a little soft, bent, I'm leaning my weight over to this leg as opposed to standing evenly or leaning away, leaning towards it. Then I'm going to tighten this glute right here without also tightening my thighs. See, that's tight thigh, tight glute. Everything's contracting. But if I just relax my knee and just get the glute to work, now we're on the right track. And then I can lean the other way and get the other side to contract, knee bent a little bit, and back and forth. Now, this is a standing version, but you can also do this lying down. Some people might need to start with this. I would have you lie with your legs flat first, and then just think about tightening both glutes, then just tighten one glute. Some people, this is easier for them. I do have a lot of people, though, that prefer to do this in standing to start. But I would want you to master it in lying down, standing, and sitting. Because you might sit a lot. You might sit for work. You might sit for your daily routine. You sit to have a meal. And what really needs to happen with this and the abs is you need to become obsessive. Because if you suck at doing this, if you're not good at firing your glutes and your abs, you need to, like I said earlier, you need to crack this. You need to figure this out. This is what your doctor's not telling you. This is what your physical therapist doesn't know about. Your doctor doesn't know about it either. Your surgeon doesn't know about it. They're trained in other specialties. They're not trying to harm you for the most part. Sure, there's a bad seed to every profession. But for the most part, healthcare professionals out there are trying to help you as best as they can with what they know. But they don't know about this. In seated, flex your glutes, not your thighs, and hold it for 10 seconds. And do it in lying down. Before you get out of bed, do it in standing. Eventually, as you're walking, you have to do this. I'll explain more about that in a minute. But you have to figure this out, or else your stenosis is only going to get worse. Forget all the crazy exercises you see out there, all the weird stretches. That's all okay. But this right here, what I'm talking about, is fixing the root problem. This is what you have to face. Lower ab activation and glute activation. I'm hanging out here and looking at you in the eye intentionally because it is that important. If you don't break through on this, you're not going to improve the situation. You have to figure this out. Now, I'll be shocked if there's other healthcare professionals singing the same tune like I am. They're just, it's not common knowledge in the healthcare industry. But I need to be able to tell you guys this. All right, hopefully I drove the point home. What's next here? All right, let's pretend you got your glutes going, you got your abs going. So we're moving on. Let's go to number 6 here. We're going to combine using the two muscle groups, the glutes and the abs, into a bridge exercise. Let me show you on the table what this is. A very commonly done exercise, commonly done wrong. But the idea is you're doing this. You're picking up your hips. And if you're in physical therapy, you've ever gone to physical therapy, you very well might have done this exercise. And they'll just tell you, get in this position, lift up your hips. And that's it. But you need to know exactly how each part of your body should be moving. Let me explain it to you. We already covered the lower ab activation and glute activation. So you need to put that into this. You're going to flatten your back. Remember, hand back there, flatten your back, because then you're going to get your lower abs engaged. Hold that. That's step 1. Then think about tightening the glutes. So back flat, glutes tight. Keep the thighs relaxed. Already at this point, we haven't even lifted. You might even feel your glutes getting tired already. They might be working. That's good. If you successfully flatten your back and feel your abs working and tighten both glutes, and you're able to maintain it here, then you can start to lift. Just lift a little, like an inch. Clear some air under your bottom and the surface that you're on. Hold it for 10 seconds. And after 10 seconds, you can come down and relax. And what you should have felt is your glutes doing most of the work. They should have felt like they're starting to fatigue a little bit. The hold is very important. You can't just lift and relax, lift and relax. Not good, because you haven't been able to fire your glutes right, more than likely. How do you know you're consistently doing it? This takes a lot of conscious effort. Back flat, butt tight, thighs relaxed. See all the thinking I had to do that? And I'm the therapist. I'm the guy teaching this stuff. I still have to concentrate to do this so that I can really fine-tune my glutes working. Then come up, and I want you to come up higher this time. We tested it the first time to make sure you're still firing your glutes when you lift, but then I want you to find the upper extreme of what you should lift. Now, right here, when I get to this point, I'm still using my glutes. Check, that's good. But I begin to feel a little bit of a stretch in the front of my hips and thighs, right here and on my thighs. So I'm going to stop. Because I know that if I go further up, it's going to put more stretch on my hips and thighs, and I don't, because that's going to actually work against me. I still feel my glutes working tremendously here. 10 seconds go by, you can relax. Feeling it. That's good. What you want to avoid, if you do all that stuff that I said, and then you come up too high and you get a big stretch here, you're setting off something called the stretch reflex in your body. And that's going to actually make these muscles want to contract on the thighs. And it's a big no-no. It's going to make your glutes not work as good. It's going to feed the compensation patterns. We don't want that. So make sure that it's glutes. The other thing too is if you come up to the extreme, you're going to have more of a tendency to use your hamstrings and your back muscles, which are other muscles that like to compensate for the glutes. The point here is to target the glutes while using good abdominal stability. Doing this allows you to strengthen the muscles, the right muscles, the glutes and lower abs, so that you're fixing the muscle imbalance, the root problem that's adding too much pressure to your spine and setting up stenosis on your poor nerves in the area. So you have to go through this. Now, bridge is an excellent exercise. It's a commonly done exercise. It's a beginner glute strengthening exercise. But the prerequisite to doing a bridge right is that you can activate your lower abs and you can activate your glutes. And you shouldn't hurt to do this either. It shouldn't be painful at all for you. All right, you guys tracking with me? Let me do one more here and then we'll answer some more questions if we have any. Who's on right now? Oh, yeah, we see a lot of comments coming through here. Fantastic. I'll get to you guys here in a second. I'm going to show you guys an advanced ab exercise from what we showed you using the lower abs. So we're going to do an ab curl. Here's what it looks like. Same position as a bridge, starting position. You're going to flatten out your back just like you did. We're not too worried about the glutes here. They're going to work. You might feel just when you fly down your back, if you're developing a good pattern, you'll feel your glutes want to engage too. Abs and glutes should work together. So that's okay. Some people are like, oh no, I'm compensating with my glutes. That's a good thing. You want that to happen. So back flat gets the lower abs engaged. Then what you're going to do is reach your fingers towards your kneecaps. Now, my head and shoulders are keeping me on the table here. What you're going to have to do is bring your chin to your chest, make a double chin, and then bring your shoulders up so that your knees, you can reach your knees. You might not reach your knees. That's okay. Just go in that direction. So it looks like this. Double chin, curl up. I can reach my kneecaps right there. I feel the edges of them, and I'm going to hold it. And I don't know if you could see it on camera. Maybe you could hear it in my voice. I'm shaking. I'm getting shaky here. I feel my lower abs working hard. Upper abs are working some too. I'd say I'm like 70-30. And I'm holding for 10 seconds, making my lower abs work the hardest by flattening my back down. And I'm not hanging on my knees. I'm just kind of reaching, touching them there. And after 10 seconds, you can relax. Repeat this. And what I have people work up to is doing 30 reps with breaks in between as much as needed. Eventually working up to 100 reps, holding for 10 seconds throughout the day. You have to get obsessive about this because this is going to boost your strength up in your lower abs. It's taking pressure off your lower back, and it's allowing your nerves to have more room because you're correcting the imbalance and getting the lower abs to now become more involved, more strengthened as well, so that the balance is returning between the abs on the front and the spine muscles on the back, the erectors. So 10-second holds, work your way up to 100 reps. By the way, I have this all a lot more organized in our back pain recovery program. Would you hand me that chart, please? The back pain recovery program, I made this program that it goes into detail. It's exhaustive on the treatments that we do for lumbar stenosis as well as a bunch of other back conditions. And I split the program into 4 phases. The idea is the phase on the left here, the phase 1, it goes to 4. This is what you would do. These are the conditions, the criteria that put you in phase 1, and it's associated with having higher pain, less mobile, more symptoms, less muscle activity. You'll see the abs and the glutes have to be firing in order to move on into higher phases. But as you get out of pain, more severe symptoms, then you can do, there's certain treatments you do, and you do harder treatments. So that ab exercise that I just did is more of a phase 2 exercise. And then I'll show you a phase 3 exercise here in a second. But the idea is you progress your way through the phases because you can tolerate more, because your pain is lower, because you're correcting the muscle imbalance. That's what needs to happen in order for you to have long-lasting relief and avoid a back surgery, because a lot of them are unnecessary in my humble opinion. Can you hand me that other chart? I got one more chart to show you related to the back pain program. Super important because this isn't explained in doctor's visits. You don't have enough time, and doctors don't even have their whole their medical knowledge wrapped around this concept. But this is something that I talk a lot about in the back pain program. This looks complicated, but let me quickly, easily break it down for you. This is age on the top, and this is damage to your spine. And then you have the potential for recovery in this line here. So when you're in your younger years, there's less damage and there's higher percentage for recovery, higher chance of recovery, versus when you're in your older years, 60s, 70s, and beyond, likely there's more damage and less likely that you're going to recover because there's probably going to be some more permanent issues. Then in the grays here, you have conditions. So we have back spasms here, side joint problems, spondylolisthesis, sciatica, disc herniations, osteoarthritis, degenerative disc disease, and stenosis, lumbar stenosis. All of these conditions we can treat through the back pain recovery program. We can help you with this muscle imbalance correction approach that I'm talking about. But what I'd like to highlight here is that there's all these conditions affect you at different ages, but they're all related to the same root muscle imbalance, which is those weak abs and overdominant back muscles. That's one of the many imbalances. That's the most common, biggest imbalance we have to fix first. If you've had this imbalance for longer times, then you're going to be older probably, and you're more likely to get multiple diagnoses. That's why some of you guys have lumbar stenosis here and sciatica. Sciatica can happen at any age. You might even have disc herniations that can happen at any age. Maybe they told you have degenerative disc disease associated with like bone spurs and other stuff like that, arthritis in the joint. But in your younger years, you're probably going to not have all these other problems. You're going to have back spasms. Maybe sciatica hits you. Maybe an SI joint dysfunction happens in your 30s. So I just want to demonstrate to you how they're all related to the same muscle imbalance. Because if you're older and you're here with stenosis right now, you probably had these other issues in your younger years. It's the same muscle imbalance. Doctors couldn't tell you. They just said, oh, it's an age-related issue, or it's because you picked up something wrong, or you lifted weights too heavy in the gym, or there's always some reason they connected to you. You're too active. It's a repetitive use injury. Like they give these vague reasons for back pain, which leaves you in a place where you don't have control, because it's like the past is the past. You lived your 20s and 30s already, and you can't undo that. You bent over wrong too many times already. You can't undo that. You already picked up those weights in an effort to stay healthy and active and strong, but the work is done. What they're not able to express to you because of their knowledge base, they just don't know this stuff, is that it's a muscle imbalance. And if you fix that, all this stuff gets better. That's why this list. All right, let's proceed here. We talked about the ab curl. Running out of space here. The next one is going to be, oh, let me erase that. It's going to be a sit-up. It's the progression from the ab curl. And it looks like this. I love this sit-up because it targets those lower abs so well. So we did the ab curl right here. The next step is to bring your legs down, and you're going to use momentum. I get dinged about this all the time because they say don't use momentum. But if you're targeting the right muscle and you feel the muscle burn, even though you're using momentum, who cares? You're targeting the muscle that you need to target. So I like to flatten out my back just to turn on the right muscles, those lower abs. And then I'll bring my hands up, and I'm going to throw them at my legs and sit up with the momentum while keeping my lower abs engaged by pressing my back down. But when I come up, you'll see my back comes up off the table, but I use my lower abs. And then when I return back, I'm thinking about pushing my low back down so that I can use my lower abs on the way down. There we go. So I'm just throwing my arms up, pushing my back down, and I'm reaching towards my feet every time. And you guys are probably watching this saying, oh, no way, I can't do that. That's okay. You work up to this. This is phase 3, phase 4 exercises, like I said about my program, the back pain program. And where we start people off is not all the way to your feet, but once you've done the ab curls for a bit and you've gotten stronger, then you'll feel it. You'll work your way up to where you say, okay, maybe I can start some baby sit-ups where you just go to your thighs. That's a lot more doable for people. Then after some time, you can reach your knees, your shins, you can get down to your ankles. Before you know it, you're getting down to your feet. And this becomes a maintenance exercise for you. If you can have good enough strength in your lower abs to do sit-ups like this for dozens, maybe even 100 reps or more in one exercise session, you could take breaks. You could do sets of 10, sets of 5, sets of 20, whatever fits your current fitness level. But if you can do this exercise at least once a week, 2 or 3 times a week, even better, and maintain this high level of abdominal strength to be able to sit you up, focusing on your lower abdominals, you're fixing the imbalance, and your back should be feeling tremendously better. And you're protecting yourself against surgery. Super good exercise to be doing. So I hope that helps you out. Let me take a break here because we're going to move stuff around and answer questions. Don't leave, guys. We're going to answer your comments and take a look at who's online here, and then we got 2 more points to cover. Who's with me here? Let's look through here. I'm going to show you guys a squat maneuver here in a second. All right, Karen Green is saying she has, okay, we answered that question. I wanted to make sure I picked up where I left off. I can't read this. Strongish spore. I have arthritis in my spine. I'm 30 years old. Oh my gosh, you're young. And it's already hard to stand up for more than 15 minutes. How cooked am I when I turn 50? Will I even be able to move? You got some imbalances you probably have to fix here. The stuff that I was just talking about, strongish spore, you need to make sure you get those abdominal muscles stronger, because it's probably putting your back muscles are likely compressing your spine. That's why you have difficulty when you stand up, because your joints aren't lining up properly. All that compression is setting up the arthritis. All those back muscles right there, when they compress a lot, they're squishing your poor little spine joints right there where I'm digging my fingernail. When you have the back muscles are sitting right on top of the joint, and when they get too strong, too overdeveloped, you have weak abs in the front over here. They're squashing the joint. You have this thing called resting tension in muscles. Super easy concept to get. But when you don't work out, you get flabby, right? Your muscles get soft. You can easily grab all the way to the bone because your muscles are relatively soft. But then you go work out. It doesn't take long. Work out for a week or two. Get in 3 or 4 workouts for a specific muscle group, and all of a sudden you feel an increased tone in the muscle, increased tension in the muscle. That's resting tension, because you're not even flexing. Muscles respond this way. But when you have an imbalance and your back muscles are constantly having to work because your abdominal muscles aren't doing their job, then you have this constant increased resting tension on your poor spine joints, and that's setting you up for arthritis. It's compressing things back there. It's squashing your discs. So the solution here is free up those muscles. So massage gun, the stretches, the stuff that I talked about at the beginning here. Then fix the imbalance, the middle part that I talked about, what I've talked about recently. And slowly over time, then you fix the root problem, and you can take pressure off the spine consistently. And you have a shot, just like I was showing you on this chart here. You know, if you're in your 30s, here's 30s. Look at arthritis. Not likely to happen at this point when you're in your 30s. Let me pick it up just a bit. Bring it over. So this line is the 30s. We follow it down. Arthritis is right here, osteoarthritis. It happens, but it's not as likely, but it's because of the same muscle imbalance that's happening that's setting you up. So we got to fix that imbalance. Come on, strongish. Get those abs stronger. A lot of people just avoid abs. I don't know why. It's hard to target. Maybe it hurts your back to do it. Some people are uncomfortable with the way their stomach looks and they just avoid the whole situation altogether. You have to take this head on and get your abs stronger. So never mind aesthetics and the way you look, for your health, so that you can walk and stand. Who else is here? Loyan Hurd says, I'm so glad you use the swan neck massage instrument. I've used a massage wand for many years and no one believes me. It's so easy to reach the back. Thanks, I'm right. High five to you. Yeah, absolutely. I love the swan neck massage gun. I think it's a savior for a lot of people. Strongish Spore says, I lifted something when I was around 19 and my back has gradually gotten worse and worse. I'm so sorry. That's no fun. Yeah, you probably got a joint that got stuck. That happens. And it never got unstuck. Like a chiropractic technique might have loosened it up. Maybe not. It might have been some muscle issue as well that needed to be addressed. Muscle imbalance. And the point is, right now where you're at, wherever you're at, you need to start fixing that imbalance, strongish. You have to start fixing it, and you'll free up the joint. You know, I think chiropractors do a lot of good. For the most part, I think they're fantastic. I think they might overdo it sometimes, and even within their own profession, they'll tell you you can start to loosen ligaments and discs and cause some problems. And physical therapists are guilty of the same thing. But what you need to know is that if you go get a chiropractic adjustment to free up a joint and you get relief, that's good. It worked. In the short term, though, we need to fix the long-term problem, which is correcting the muscle imbalance. And a lot of chiropractors will agree with you on this. It just depends on who you're talking to, what their training is. Who's next here? Minnie Joseph says, I have swelling and tightness on inner thigh and unable to squat. Give some advice, please. Okay, let's get into the squats. This is a good question to start wrapping up the list here. So number 9 is a mini squat. I need you to be able to do a squat because it's a functional motion. In other words, It's something that you'll do the rest of your life very practically to just do normal daily activities. Like you have to squat down to pick up something, to lift heavy things, to sit down, you have to squat down, to use the toilet, you have to squat down. There's so many reasons to be able to squat. So let's learn how to squat properly, using the right muscles. We have to use lower abs and glutes. So to start a mini squat, let's just get the top standing position first. Oftentimes, if you have weak abs, people's backs arch because these back muscles are over dominant, so they start to tension down and they'll pull your back into extension this way. When you go into extension, it flexes your hips on the front, so it shuts off the glutes because they get lengthened, and it makes the hip flexors more active, so they get shortened. There's the muscle imbalance. So we have to counteract that by sucking in the abs to flatten the back, and then tension the glutes to push your hips forward and straighten them out on the front side. That's the standing position. Let me say that differently. Flatten your back, activate your abs, glutes tighten. It's a forward hip thrust with a slight slouch up top to make your abs activate, and you have to focus on lower abs. That's the starting position at the top. We're talking mini squat. To do the mini squat, then all you're going to do is unlock your knees and bend them a little bit. And when you're here, continue to shove your hips forward and flex your abs in, which is going to make your shoulders and your head want to flex down. Let me show you the front view. Sucking in my abs. That makes me slouch a little bit. I feel my abs working. Push the hips forward. Feel the glutes working. Then the piece I want to show you from here is push your knees slightly out, because that activates glutes even more. Because that's the goal here, is to use the right muscles during the squat. What you should be feeling when you squat down is glutes and abs. Mini squat is great because it teaches you to use the right muscles. Because if you don't think about these muscles very much like the bridge, you just go through the motion. If you're just doing repeated squats like this, oftentimes people's squats look like this. They stick their butt way back out and then come right back up. And when you do that, you're using a lot of back muscles, because they have to, when you lean forward like this, the back muscles have to hold you up. But if you tuck your butt under your spine, back muscles don't have to work as hard here. They might work some, but your glutes have to work tremendously to support you in this position. Your abs have to work some too to keep your hips forward, because they work with the glutes. So this is a much better movement to do. The problem is people can't do a straight on squat like this because they're not trained. They're so imbalanced that if they try to squat like this, they start to tip back. And the reason why people fall back is because back muscles want to take over, and they want to contract back here and make you extend. So if you try to go straight down, you might feel like, oh, there's a point where I just can't go and I lose my balance. It's because your back muscles are taking over. So mini squat is a great solution to teach you to just do a squat properly here. And as you get stronger, you can go lower. And over time, over weeks, maybe even months, you can do a full-on squat. Then you can eventually throw some weights into this. And then eventually, as you continue to use your squats properly, use your glutes properly during the squat, you can begin to do reps. But start with the holds and just do a partial squat, a mini squat, and work up to full range squats and eventually weights as you can, only using your glutes, primarily using your glutes. I got to say it that way. All right, I hope that helps. Losing my breath here. Let's go to the next one, number 10. This one's controversial for me because here's what it is. Cycling. And that's specific to stenosis, because I often don't recommend cycling. I'm not against it completely. It's like walking to me. You know, like I tell people stop walking, and they take it as Dr. David says never, ever, ever walk. Only to go to the bathroom and to eat food, and that's it. That's all the walking you should do. Don't ever walk any more than that. And that is not what I'm saying. I'm saying don't go walk for exercise like a lot of doctors and physical therapists will tell you to do, unless you figured out how to activate your abs and how to activate your glutes. Once you got this down, go walk. Go run if you can. Walk for miles. Go hiking. Have fun. Window shop. Walk through every aisle at Target. Do whatever you want to do walking, as long as your abs and glutes are activating. It's the same thing for cycling over here. You should avoid cycling if you can't fire your glutes and abs properly. But once you figure that out and you can activate your glutes in cycling, which I'll show you how to do here in a second, and you consistently do it, it doesn't take too much brain power for you to do, because at the beginning it might, but as you practice it and get better at it, it takes less conscious effort to use your glutes while cycling. But then it becomes a cool exercise for nerve gliding. Here's the thing let me write it down. Do a different color. With nerve gliding, I also don't recommend nerve gliding a lot. But you're constrained to the cycling pattern when you're doing nerve gliding here in cycling, because you're pedaling. You're not doing any weird stretches, any weird motions. A lot of people that are teaching nerve gliding, usually physical therapists, they're having people do these weird foot and hand motions and head motions too. And I get it. There's a science and a reason for all that, depending on which nerve you're trying to target. However, it's commonly done wrong by patients after they leave the therapist, because it's so specific and hard to remember for a lot of people. So people get it, but most of them that I've worked with don't. And I've spent time explaining it to people. But cycling helps nerve gliding tremendously. Let me show you how. Let's get on the bike here. So let me size this up. This is a little low for me. You want to have the seat about as high as your hip bone. So my hip bone's right here. This is too low. Let's bump that up. That's better. Might be still a little low. And this bike has these cages for your feet. I'm not going to use them just so I don't stumble while I'm live streaming here with you guys and create a funny blooper. This is actually a little too high for me. I'm going to lower it. The reason I said it was too high is because when I pedaled, my knee locks out. It should have a little bend in it. It's hard for me to keep it bent. It should be easily kept bent. If you have the seat too high, then it's going to add tension to your nerves. Yeah, that's better right there. So when I go to the downstroke of the pedal here, my knee stays a little bent. That's good. Now, when you downstroke on the pedal, so let's just focus on this leg since you can see this leg better. When I'm pushing down right here, my right glute should activate. It should tighten up a little for a moment. You might start out real slow, like as slow as I'm doing this, just to figure this out. But every time you push down on the pedal with that leg, with my right leg in this case, glute should tighten a little bit on this side. Then alternate to the other side when the other side goes down. So each time you pedal down, the glute should tighten up on the leg that's going down. This is the same thing that should happen when you walk, by the way, because it's how our legs are designed to move. Every time you bear weight when you're walking, let me just show you nearby here. When I stand and put weight on this right leg, this glute on this side should kick in. And then as I step onto my left leg, my left glute should kick in. That's how the hips are designed to work. So if you're using them properly while cycling, then I'm okay with it. If you don't, by the way, what's happening if you don't use your glutes properly? It's a lot of thigh muscles working. And then you're feeding the imbalance that sets up stenosis in the lumbar spine. But if you intentionally fire your glutes, then you're going to, by default, shut off your quads, your thighs. They're not going to work as much. And you're going to tire out your glutes because it's glute, 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 glute. And if you go like that for 10, 20, 30 minutes, you're going to get a heck of a workout. Simultaneously, your nerves are moving in your body. And if you're sucking in your abs a little bit, like you should be constantly doing, get in a comfortable position, lean forward a bit here to take pressure off your back. Now you're doing a great sciatic nerve glide, focusing on using your glutes and focusing on using your abs. But it's conscious effort. It looks like I'm just biking here, and you wouldn't know if I didn't tell you that I'm using my glutes consciously, left, right, alternating every time I'm on the downstroke, and then I'm sucking in my abs. You wouldn't know. You have to go through this training, and you have to be conscious about it. That is the key here to using the bike properly. All right, now I'm on a stationary bike. Obviously, this is great for all weather conditions as long as you're indoor. They've got fancy ones with screens and subscriptions you can join that are really fun. The Peloton's what I'm talking about. You might have access to a bike like this at the gym. You can go outdoors too if you have a bike for the road. Just I would avoid a mountain bike on bumpy terrain because you're going to be way more worried about falling or not falling then you're going to not have your full attention on your muscles. That's what I want you to have. All right, so that covers all the way through 10. Another one that I want to just highlight to you here is avoid using your back muscles. Focusing on exercises that isolate back muscles, because as I've already hopefully stressed with you guys, is back muscles tend to be overcompensating for weak lower abs. Another one is hip flexors. When your pelvis is tilted forward, it shortens your hip flexors, and your hip flexor muscles, specifically the psoas major muscle, can put a lot of compression through your lumbar spine and add to the stenosis problem and other problems like disc herniations and sciatica. It can pinch the nerves. And then the quad muscles can also feed into the imbalance because of their attachments. One of the quad muscles, the rectus femoris, can act as a hip flexor. And so if you make the quad muscles work a lot, then you get the hip flexors involved, then you start to get the hip psoas involved. It's a whole chain reaction. You don't need to know the details. If you want to just, the simplest form is work out your abs and your glutes, and that will shut off your back muscles and your quads and hip flexors, and you're going to be good. All right, guys. That's my lesson. I'm going to answer questions next and take your comments. Let's see who's here. We have Facebook is still not working. I apologize to you guys on Facebook, but we're here on Instagram and YouTube. All right, we answered this one already. Let's go to Minnie Joseph. He says, I have swelling and tightness on inner thigh and unable to squat. Give some advice. Yeah, absolutely. I would want to know what's going on. Is there like a joint problem, muscle problem? When does it come on? I need more details than this. This is just not enough. The possibilities are an imbalance because the inner thigh muscles can work like the quads and the hamstrings. It's a thigh muscle. They often are compensating for weak glutes and weak abdominals. So that's usually the problem. There could be some joint issue. There could be a nerve problem. Those are secondary problems, not as common, but they do happen. But usually it's a muscle imbalance that needs to be fixed so that you're not overusing your inner thigh muscles, the adductor muscles or the groin muscles. So hopefully I'll catch another comment of yours with some more details here. Strongish Spore says, you reminded me, I also have degenerative disc disease. Yeah, I tell you, it's all connected. That's why this is a big deal, because doctors will, you go to a doctor for back pain, especially like an orthopedist, they'll do an x-ray, they'll do an MRI, and then they'll just casually tell you, oh, you have stenosis, degenerative disc disease, arthritis, and a herniation, plus you have sciatica symptoms, of course, and maybe the therapist will tell you have an SI joint dysfunction. And it feels like you just got destroyed, right? You just got told you have 3, 4, 10 different things wrong with your back. And then comes the how do we fix it question. And do we have to do something special for the disc herniation versus the degeneration versus the sciatica versus this arthritis? And and a lot of healthcare professionals think you do need to do different things for everything. They'll say, well, we're going to inject the joint for pain relief. Then we're going to do some stretches for sciatica. And then we're going to do some traction or hanging upside down for the disc herniation. And they'll just throw all these treatments at you. And they forget that, or they don't really know that it's a muscle imbalance at the root of the problem. And all those other treatments might help in the short term, but they're not really targeting the root problem. And that's what needs to happen. So don't be surprised if you get told you have multiple diagnoses. That's why I made this chart here so that you can see that they're all connected. You need to treat the root problem. That's where you fix it. That's where you fix all the problems. And don't be surprised if you got diagnosed with one of those, if you eventually get told by another doctor, you have another one. A lot of people, they visit different doctors and they'll say, well, this doctor says I have A, B, and C, and this other doctor says I have X, Y, and Z. Which one's right? They're all probably right. They're just looking at different angles of the same problem. It's the root problem. All right, RTHO225 says, you are the best, David. A ton of improvement in my arthritic hip thanks to your program. Oh, that's fantastic. I'm glad You're improving. Happy to hear that. I appreciate it. Thank you so much for letting me know. Nancy Morales says, hi, hello, Dr. David. We have Tam Jack says Tam in England. Fantastic. Hey, Tam. Got a couple people from England here. Hello, young man. From where is strong arm, flexing arm? We have Kimberly saying, those dang glutes. Yep, you're right. I have learned how to activate them with the help of your channel. Great, Kimberly. It's a climb for some people. They can't even get it. And you know, some of you guys are watching this and you're trying to flex your glutes and you're saying, oh, piece of cake, easy. You're lucky. That's great for you. Then you've got to go through strengthening them, which is the next hurdle to go over, because it's work to strengthen any muscle, but the glutes especially. That's why I tell people you got to get up to doing 100 reps a day. Like, you just have to do it. You have to get obsessive. I use that term a lot. You have to get obsessive. You know, I feel like obsession is used in a negative way a lot of times, like you're obsessed about something bad, but you can use the power of obsession for something good, like your health, and not in a way that's, you know, messing up your relationships or anything like that. Because, you know, you have people that like work out way too much. They're in the gym, you know, as much as a full-time job or even a part-time job. There's issues there. But what I mean is figuring out, obsessing with how to get your glutes to activate, then obsessing with how to get your glutes to activate in a squat, in walking, as you're standing in line somewhere, as you're doing this new exercise at the gym, as you're on a bike. You need to figure out how to do that. And then there's just a time where you obsess over it. And after that time passes, for some people it's weeks, for others it's months. Then it hopefully becomes a habit. And you don't have to obsess over it so much, because now it's a part of what you usually do. It's how you move. I need you to get to the point where you feel weird not using your glutes and abs. That's where you need to be, because right now you're likely feeling weird using your glutes. You're trying to walk, doing the glute walk like I talked about, and you're thinking people are looking at you, and nobody's really looking at you. Nobody cares. You feel weird because you're changing the way you walk, but you need to go through that. You need to figure this out so that it's a normal thing you do, and then you feel weird when you're not firing your glutes. That's where you should be. Yes, Kimberly, those dang glutes. Let's figure those glutes out. Thank you, Kimberly. Karen Green Hayward says, I've had to give up walking due to spinal stenosis. I'm so sorry, Karen Green. Please share tips on how to develop the ability to squeeze one glute at a time. I can't get this right. Yes, I'm sorry, Karen. The leaning on one side helps. So like shifting your body weight, doing it in sitting, standing, and lying down. Try different positions. Usually there's one position that you can get traction on. And it's not the same for everyone. Some people figure out in lying down. Some people do a great in seated. Others don't do good in seated or lying down, but they can do it in standing. So try different ones. And then once you have some traction with one, hang out there for a bit. Don't worry about the other two. Make standing glute activation your thing. Get obsessive over that. And then slowly start to add in the next one that's easier for you. Maybe it's sitting. And then finally lying down. The idea, though, is that you should be able to do it across each, like all those different ones, standing, each position, standing, sitting, and lying down. Then do one side at a time in each of those positions. In seated, you might need to lean over while you're seated. In lying down, you might need to put a hand back there. Literally squeezing the muscle, squeezing your butt muscle might help you activate the muscle better. You could take it to an extreme. I've had people put on the electrical shock, the electrical stimulation devices, the ones that are used for like pain relief and muscle activation. You can order them online. You could put those electrodes back there and turn up the juice, and it'll make your muscle want to contract. And if you can time your mental contraction, like you trying to contract on your own with the when the buzz comes on, that's another way to do it. That's an extreme. That's something that's used in physical therapy, like after surgery on a knee. You want to get your quads to activate, so they'll put electrodes on your quads, and it'll cycle through, you know, every 2 seconds, 3 seconds, and you have to just think, okay, here comes. Now use your muscle while it's giving you a little bit of a shock, and then relax when it stops and use it. That's an option. I'm just trying to give you ideas here, Karen. But I would go with just starting that one position. Go hard on that one position that you feel is working for you, and get it get it to go on each side. Get those glutes working. Good questions here. Who else is here? Kathy Sabo says, and it doesn't help if you have a belly, which throws your balance off even more, which makes your back muscles have to work even harder. So true. So true. You know, if you think of pregnant ladies or you think of people that just have a big belly, it's pulling you forward. Let me see if I can manage the camera here. If you have a big belly here, it juts out like that, and it makes your back want to extend. It makes your back muscles want to work harder and be used more. And so you want to make your abs work hard, even if you've got that belly. You have to just go through it. Yeah, lose weight. I could say that. You know you need to lose weight, but I'm not a weight loss coach here. I'm not here to tell you that. I'm here to tell you you need to use your muscles. Start using those muscles, those ab muscles. All right, who's next here? We have FHT58N. You are 100% correct. The glutes is key. Yes, I have studied this stuff for a long time. I've worked with lots of patients. I've developed the programs for this stuff, and we help people in our programs every day with fixing their back problems, fixing their hip or knee arthritis problems. And we have other programs too. And consistently, when it comes to lower half of the body, the glutes are a missing link for a lot of people. That's why I hammer it home, and I will stress it. I will put it on my gravestone that you didn't fire your glutes enough. That's why you have your problem. Another comment, at this rate, I'll be able to slide in the first base when I get back on the ball field. I hope so. I hope you get to enjoy. That's what it's about, right? You need to have fun in this life. That's one of the big reasons why we're here. We got to be smiling. We got to be happy. And if baseball does it for you and sliding home and getting that score, let's get those glutes working for you so they're not stopping you. Karen Green says, this is so helpful. Thank you. You're welcome, Karen. Absolutely. Happy to help. Darlene says, feels good. We got some thumbs up. Believe me, I've talked a lot of quack doctors. And I've got called a quack, and it really just depends on its beliefs. It's beliefs, very much so. I was reading a comment on one of our videos on carpal tunnel recently, and because one of the things that muscle imbalances is my thing. I tell people to use your palm muscles right here because the way the bones are connected, the way the ligaments are connected. I have a logical reason for this, and I've done this with patients, and they've gotten better. Yet somebody with some medical training is telling me you're doing it wrong. We need to work on extensors. And there's a whole thought process I've done on this stuff, and I don't want to get into it. I'm not going to answer that comment. If you're watching this right now, I'm not going to answer your comment. We can go back and forth forever. Do the thing. Try this out. Put me to the test. Put me to the test. I want you to. I want the research done on this stuff. I want to be proven wrong because I don't want to tell people the wrong thing. But I can't deny it when I have a patient who I tested their muscles and your abs are weak, your glutes are weak, you have stenosis, you've already worked with a therapist who made you work your back muscles, you worked on your quads and hip flexors, and you only got worse. What are we doing here? We're just marching our way into surgery. And all the pain relief stuff, pills, injections is so short term. We all know that. It's not going to fix the problem. It's just holding you off, buying you some time. But why don't we just try fixing other muscles that we haven't touched? Abs and glutes, and figure out how to make them work in these exercises. All of a sudden, people start getting better. I have to present it this way then. I have to talk about it to you guys. And I'm getting more feedback. There's people commenting on here saying it's working for me. So that's why I say this. And you can call me a quack if you want. I know you're not FHT58N, but I've been told that, and I don't care. I'll be the quack. Totally fine if I'm helping people out there that do put this to practice. No muscle, no body posture. Yeah, posture is another one that gets talked about a lot. What is posture? What's good posture? How do you know that's good posture? If we apply the ideas of muscle imbalances. Like I get told to have good posture a lot of times, and I'm not even trying. I'm not trying to hold up my posture right. You know why it looks like I have good posture? Because I have muscles that are in the right balance. If you fix the imbalances, very often your posture improves without trying. But you have people that have poor posture, according to the experts out there that look at posture, and you tell them to straighten up, and you have this, straightened up posture, and all of a sudden they're like, oh, my back muscles, I can't hold it. It's because we're not designed to do that. Posture, I think, is a whole other thing we could talk all day about. That I disagree with the leading thoughts on what good posture is and ideal. To sum it up, the ideal posture is there's no ideal posture. You do activities. You're not designed to work like a statue. Desk jobs are not normal for the human body. We do it because it's the world we live in now, but you're made to move. That's why you have joints and muscles, cartilage, ligaments, all our musculoskeletal system is designed to make us move. Go move. Figure out your muscle imbalances and fix those. You're going to be way healthier for the long term so that you can live to the end of your life without having chronic pain that stops you from doing the things you love to do, the things you're meant to do. Don't worry about posture too much. How do you squeeze your butt sitting? Yeah, that's a good one. You let me see if I can demonstrate. I don't have a good angle anymore. You just have to tighten the butt muscles. I don't know how else to tell you. You have to figure this out. Shadings. You have to get those glutes tightened up. When you're sitting down and you tighten your glutes, you'll elevate a bit. You can put your hands under your butt while you're sitting down and use your fingers like this and think and make your muscles tighten up. You have to get this. See, the fact that everybody's commenting stuff like this, like, how do you do this? I'm having trouble left from right. It proves my point that there's so many people out there that struggle with this, and it's probably a direct cause to lumbar stenosis. Practice it. Lots of practice. People underestimate how many reps, how obsessive they have to get with this. And it's not even a number of reps. It's until you figure it out. I get called, being like sarcastic or maybe even like borderline rude sometimes to patients. But I've yet to have a patient call me out directly. I've just had like friends, coworkers, colleagues tell me, because I have some patients that will say, well, by when can I expect to get better? How many months? How many weeks? Because that's what everybody's looking for. And my answer to them very often is, as long as it takes. How long is it going to take you to get your glutes to activate? There's no magic number. For you, Shadings, it might take 3 months. For Kimberly, for FHTN58, it might take 3 weeks. It might take 3 days. It might take a few years. The difference is how many reps are you getting within that time, and why keep count? Just do it. Just get it done. We don't have to be on a scheduled plan for this. Just build it into your schedule where you're doing this every hour until you figure it out. That's what it takes. You have to just keep going. Figure it out. There's been things I'm sure that you've done in your life that you didn't have mom or dad's help. You didn't have help from a friend or family. You just had to do it on your own. This is one of those things. For a lot of people, you can't rely on a healthcare professional to go in there and magically do something to you. You just have to sit there and make those muscles work and practice it and you might need to take a break. You might come back to it in an hour. You might come back to it tomorrow, but don't stop. Don't quit. Don't give up. Don't tell yourself this is fake. Can't fire butt muscles. I had people tell me that. People in our groups that paid to be in our groups, they're telling us butt muscles can't fire. It's just because you haven't put enough reps in. You haven't truly cracked it. No pun intended. You haven't really figured it out. You need to figure this out. I'm here to give you that swift kick in the behind that you need more effort. Darlene says, great information. MJ Aroma says Dallas. You're in Dallas. Fantastic. We got a thumbs up from this person. And Brandon Campbell says, what does cuboid syndrome feel like? I can't walk. I don't know if it's a stress fracture or cuboid syndrome. I've had cuboid syndrome, and it was misdiagnosed as a stress fracture. And I'm a runner. It looks like you're a runner based on your profile image there, Brandon. I ran a lot. I still run, and I don't have any more cuboid syndrome, thankfully, because it's usually a foot strength problem with the fourth and fifth toes. You have to be able to curl those fourth and fifth toes enough. And the best thing to do to know if it's a stress fracture or not is go get an X-ray. If it's early on, if you just got told you had a stress, if you just started having the pain like within a couple of weeks and you got the X-ray, you can't see the stress fracture yet. But the stress fracture will show up on an X-ray as thickened bone because healing's occurred there. So you'll know you have a stress fracture. In my story, I started getting pain, went to a doctor. They did an MRI, they did X-ray, and they were like, we can't quite see anything, but it looks like you're probably going to have a stress fracture. You've been running so much. You're a big guy. You're not supposed to be running because you're so big. I get told that all the time. Yet I run miles, and I'm going to be 40 soon, and I've been running my whole life. I was put in a boot. That's because they thought it was a stress fracture, being a boot. Months passed. It was almost 3 months, and I was like, surely a stress fracture should have healed by now. It takes about 6 weeks, but I still had pain. So I went to a different doctor. I actually saw a podiatrist. She took an X-ray. I was in PT school during this time, so I didn't know fully how to deal with this. I was learning how to not hurt people, basically, in PT school. Do treatments that aren't going to be harmful. And when I saw the X-ray, and she saw the X-ray, she said, "There's no evidence of a stress fracture." And then she said, "You probably have a stuck joint, cuboid syndrome." She didn't call it cuboid syndrome. She said, "You probably just have a stuck joint." She said, "One time I accidentally popped this guy's foot with the same situation as you, and it got better." She said, "I don't know what I did, but I can try it on you." I had her wiggle around my foot. Nothing happened. She said, "Just start walking on it. Just start using your foot." So I did, and it started to get better. It improved. And then later on, as I got my more advanced training that I have now, I started to piece it together, and I said, I had a cuboid problem, a dysfunction, a cuboid syndrome, all kind of the same thing. And I know how to move the cuboid bone, not on myself, but on somebody else. But more importantly, because you can pop it back into place if it's shifted out, you can get a lot of relief doing that. But that's short term. It's going to get stuck again. It'll shift again. You have to get that fourth and fifth toe strength. Your outer toes are key in stabilizing the structure of your foot where the cuboid is. It's a bone in the foot. I don't have a foot model with me, otherwise I'd show you, but I hope that helps, Brandon. Good question. All right, guys, we're going to wrap up here soon. We've got time for maybe a couple of more good questions here. Barbara gives a thumbs up and a wave emoji. Hey, Barbara, looks like you got your hubby on there. Glad you guys are joining us. Kathy Sabo, question marks, and then says, if you have lower back stenosis, can you feel it in your upper back / shoulder blade area when you lie on your back and move your head from side to side? Yes. Remember, I said at the beginning of this, if you've been watching, it's your nerves get tensioned up. Here's another explanation for this that hopefully makes sense for you, Kathy. If you think of a onesie, I'm talking about like baby clothes. The one clothing that has a zipper that starts at the baby's foot, their ankle, and then it zips all the way up to their neck right here. It's all one unit of clothing. If you yank that onesie at the collar right here, if you yank it hard enough, eventually the tension builds up in the cloth, and you'll be tensioning the cloth all the way down at the foot. Our nerves are like a onesie, but on the inside, it's all interconnected. Our brain and our spinal cord and all the nerves that come out to the sides that go all the way to your fingertips, your toe tips, it's all one unit effectively. And so if you start getting compression or tension from stenosis, lumbar stenosis, in your lower back, let me see if I can lower this camera so you can get a better look at my back here. You get that out of the way. Okay, so if this is happening because you've compressed the joints here, and then you go to reach your arm, you see how the cloth is tension? You see how much my sleeve's going down on my arm? Versus if I didn't have my shirt all bunched up, my sleeve doesn't go down as much. But when I do this, my sleeve starts to come down at my arm right here. It's because of the way that we're connected on the nerves on the inside. So you guys have all probably had the experience where you sneeze or you cough or you shift a certain way and then you feel a sensation somewhere in your body, like in your leg, in your foot, on your back, that is because of the way our nerves are connected. So it's very possible that you could have some connection from your lumbar stenosis to your shoulder on your back or your upper back area. It's very possible there's something going on in your shoulder too, maybe even your ribs, there's other issues, but this does happen. I just wanted to highlight that to you, that it's a possibility for you. Hopefully that helps, Kathy. The take-home point from this is it's connected, fix the root problem, and it should probably go away. All right, who's next here? We got Deborah in Virginia. Fantastic. We have Dr. Martin, Dr. Martin. Thank you for this. You're welcome. Wisconsin mom says, but is arching your back good for herniated discs? Spondy. Those sit-ups would kill my back, and I'm 74. You don't want to arch your back backwards like this. You want to flex your back. This is extension. This is flexion. When you're doing the sit-up, you shouldn't have very many moments at all of extension because you're starting by flattening your back, which puts you in flexion, and then you're using your arms to sit up to use momentum. But let me back up a step here. If you're thinking it's going to hurt your back already, you should probably be doing the ab curls. Very controlled, slow, no momentum, focused on using your lower abs, and make sure before you do the ab curls that you have good ab activation, because there's a chance that if you're skipping this step over here and trying to get to ab curls or sit-ups, you're going to compensate right away with hip flexors, upper abs, or back extensor muscles, and that's probably what's going to hurt you. This is why people that have back problems like stenosis, disc herniations, will try sit-ups and then feel worse. And it's because they're not activating the lower abs properly, and they just manage to do the sit-up all compensated. They're using the wrong muscles, and then they get more compression through the spine as a result of this. So you have to go through getting activation here. That's why I wrote figure it out. And I hung here for a while. This is probably the longest section of the video where I was talking about ab activation and glute activation. You have to figure this out. Otherwise, everything else afterwards is going to hurt you. It's going to be negative for you. And then I don't want you running into the situation here, Wisconsin mom, where you're saying, well, I tried Dr. David's stuff. I tried the bridges. I did the sit-ups, and he wanted me to do those crazy sit-ups and mini squats. And then he talks about lifting weights in other videos, and it hurt me. Did you activate your abs right? Are your glutes working on command? Can you consistently activate these muscles right without compensating? Make sure you got that down. I hope you get that, Wisconsin mom. Hopefully it's helpful for you. All right, let's do one more here. Mindy Gross. Hey, Mindy. I was getting in and out patient PT for 5 months, and not one therapist mentioned glutes. Your glute videos made me feel and walk better. So grateful to you sharing your expertise. You're welcome, Mindy. It's not their focus. I don't blame them. I do and I don't. I say this often to my staff. It's everybody's fault and it's no one's fault. It's the culture. It's the beliefs of the medical system, the current evidence that we have that guides us, that kind of pushes us towards other stuff, not glutes. And that's what they get taught in school. But then it kind of is their fault in that they could have sought it out like I did. But our education system doesn't push that. I'm weird. I'm different. I like this stuff this much that I look at it this way, and I have come to this point where I'm talking to people about using their glutes on the internet for back problems and hip problems and all that. So I'm just an anomaly. But anyways, I'm glad that you're getting better and glad that you found us, Mindy. And for everybody else watching, I hope that you can have the same experience as Mindy. But you got to apply this stuff. You got to go through the right process and make sure that you thoroughly understand it. It's not, I don't, making lists like this, I probably sound repetitive to a lot of people if you're following me for like hip pain and knee pain and back pain problems. It's because of those muscle imbalances. You have to fix muscle imbalances because that's the root of the problem. I think of like other health conditions that we have out there, like diabetes, obesity, hypertension, blood pressure, high blood pressure, cholesterol problems, lipid problems, triglycerides, like all those are separate problems that I've rattled off, but they're all related to diet and exercise. And we have all these drugs to treat just hypertension and to treat just cholesterol and just obesity and just diabetes. And all the physicians that will prescribe you those drugs will tell you, well, you got to work on your diet and exercise. And that's the simplest, most straightforward problem to fix. It's just that taking a pill is so easy and it's so convenient, but it's not fixing the root problem. That's what needs to be fixed. And so when it comes to back problems, hip and knee problems, yeah, we can get a surgery, we can get an injection, we can take a pain medication. Doesn't fix the root problem. And our medical system is just focused on short-term fixes. There isn't a lot of attention given to the long-term fix here. So that's why I'm that voice. I hope you guys benefit. Thank you guys so much for joining me. I hope you get out of lumbar stenosis problems. I hope you never have to have a surgery. And if you want deeper information than what I presented here today, go check out our back pain recovery program. There should be a link in the description. If you're just now watching this, if it's pretty live, it might not be there yet, but check back, it'll be there. You can go to our website and find details on the back pain recovery program, and you can get a lot more help directly from me and my team. And it's just more thorough, more structured, and we can make a big difference in your life there. Thanks for watching, guys. I'll catch you next week. No, I won't be here next week. I'll catch you in 2 weeks. Have a wonderful couple of weeks.